I do have an issue where when people are like, oh, let's say biotin is really great for hair. So is zinc. So is copper. So is manganese. So are the methylated B vitamins. So what you gonna do? Go and buy a boatload of supplements and have a suitcase to carry around with you for your hair only? What are some other vitamins and minerals that could contribute to hair loss? Okay, and there's many. So people ask about biotin, right? I mean, Mandy, somebody was asking about biotin, right? What was that question about biotin you saw in the group?
Yeah, one of the users said that they see biotin recommended a lot for hair loss, but they've been told that it was bad for your thyroid.
Not true. I love busting myths. Biotin is not bad for the thyroid, okay? Biotin actually is a wonderful vitamin to actually take for hair, skin, and nails. It's really great for connective tissue.
So one of our users said, does taking prednisone cause hair loss?
Yeah, it can. So lots of medications actually for autoimmune, one of the side effects are going to be hair loss. And if you think about what prednisone is a hormone. And it's a very high dose of a hormone. And what happens is when you take a high dose of a hormone, and this applies to birth control pills too, as well. Birth control pills is a very high dose synthetic fake hormone. So when you take really high doses of hormone as a pill, number one, it stresses out your liver like crazy, taking hormones orally. Secondly, it can suppress and push down a lot of your own hormone production. And it throws hormone balance up the haywire like crazy. So what I find in our programs is that people on prednisone have really jacked up hormones. Is it fixable? Hell yeah. And why are you on prednisone anyways? Because your autoimmune disease is out of control. So it's really even more important for people on meds like prednisone, hormonal meds, and their autoimmune's going nuts. This is like get to the root cause to actually calm the whole attack of autoimmunity. And then you have the best chance in hell of successfully getting off prednisone or any other medication in autoimmunity. You got to deal with the root cause first. This is why you want the 5 pillars training. You haven't seen it. You want to know what my secret sauce for dealing with all the triggers and the root cause of autoimmunity, put 5 pillars in the comment section right now, and we will tag you in that training.
Another user said, is it recommended to take the minimal, essential, and ironworks together?
Yeah, that's perfectly fine. Just so you know, iron, just like calcium, is really big as a molecule. So in a multi, you'll never get an adequate amount of iron or calcium for that matter. Those will always have to be extras that you add additional to minimal and essential, which is why our calcium, magnesium, zinc is separate. We have a separate ProCal Mag Zinc that's separate, and we have an Ironworks that's separate. Just like B12, we have a B12. You will never get, if you truly are B12 deficient, you won't ever get enough from a multi. Don't expect that. If you truly have a deficiency in any of these B12, the iron, or the calcium, those are important to get separately and take separately. And we carry each one of those in our store as well. That being said, though, I do have an issue where when people are like, oh, let's say biotin is really great for hair. So is zinc. So is copper. So is manganese. So are the methylated B vitamins. So what you gonna do? Go and buy a boatload of supplements and have a suitcase to carry around with you for your hair only, right? So I'm all about simplicity. I'm all about cost savings. I'm all about efficiency. I want effective stuff that's minimalistic that works. So my favorite way to supplement on this one is a multivitamin we carry in our store. We actually have a hair loss essentials line. And if you look at the top of this video, there's a link to our hair loss essentials line, and all the products I'm talking about is going to be there. But I really, more importantly, I want to teach you guys the why. Okay. Don't just go blindly buying a whole bunch of stuff. I want you to listen up and learn the why and figure out what you actually need and don't need. Minimalism is good. Okay. So minimal essential. Why do I like it? Well, it is my favorite vitamin overall for autoimmunity as well as hair loss anyway. And the reason being is that it really has the crucial best quality form of all the vitamins that are crucial. And it's in a one a day. How many times do you have to order a multivitamin? They're like, take 6 a day. Who the hell is going to take 6 a day of a multivitamin? I'm not going to do it, and you ain't going to do it either. So one a day, minimal essential. And I love the fact that it's minimal because everything in there is the really best form of it. We got methylated Bs in there. We got the proper amount of copper and zinc. That's perfect for autoimmunity. Okay. And you got trace minerals in there, like the manganese, like the selenium in there. They're also crucial, not just for hair, skin, and nails, but for autoimmunity and thyroid health as well. So you really can't It's like a win-win is just one multivitamin, minimal essential. Why not do that instead of your boatload of supplements and said, oh, that's good for hair. And then you have to add all the good stuff for skin or the good stuff for pain. Before you know it, you got $1,000 worth of supplements. Don't do that. So I'm going to tell you, take minimal essential as a multi, and that's going to cover a lot of these trace elements that we're talking about in the proper dosage of a one a day. So absolutely, you got zinc, manganese, selenium, copper. You got B methylated B vitamins, one multivitamin a day, minimal essential. Boom. And if you look at the top of this video, there's a link to my hair loss essentials line. I'm also going to have members of my staff put in the comment section the link so you can just go there and you can see everything that I'm talking about.